So you've said hello. Are you asking me or telling me? Are you asking me or telling me? How old is he? 50 years of age. Right. No comorbidities. So he's 50 years. He could take 2 and 2, not a problem. If you're happy with 2 and 2, that's an issue. But I wouldn't give any more whatsoever. Yes, sir. Yeah, fine.
The patients we took in the beginning, 2 patients. They were having bulbar colonoscopy.
They probably ate last night. They probably had something to eat last night. But, yeah.
अब हम पॉइंट शुरू करने जा रहे हैं, ठीक है?
Taking his advice. I want this lens, you see. So we're just asking him. I'll buy it. Next week. Where were you last night? Are you?
Fever.
Your hand's gone forward. No, you don't want. Your hand is forward. Look. Your hand is here. His anus is here. The direction of flow is here. You're doing this to do this. There. See? Don't let your hand drift forward. Bring your hand back.
He's doing something wrong.
Your hand has gone forward. Right. Now look, see your hand? It's gone down. Chew. This'll do. This'll do. Yeah? Ah, brilliant. Yeah. Look. Anus forward. Here, this is what's happening. Here, this is what's happening. Here, that's what's happening. Here, that's what's happening. Here, it'll go forward. Think about your direction. That. Okay, not down. So the hand mustn't come up to go down. Okay, so with regards to hand, the anus is that direction. If your hand is up, it pushes down into the bottom. If your hand is forward, it pushes backwards. Hand is back, it pushes forward. And if your hand is too close to the bed, and that's what's happening with the scope. That's why you're not advancing. Okay?
Well, I missed that one. Can you, what were you
what I was explaining is that his hand position, he's doing it again. So his hand position, this is the anus. And if you actually think about a rigid proctoscope, the direction a rigid would go, it's that direction. However, he's allowing his hand to drift forward, so he's actually pushing backwards to the sacrum, and then the scope is wanting to come round. So you're losing the directional force. If he lets his hand go too close to the bed, it comes down instead of going in that direction. If it's too high, it pushes down into the bed. And if he pulls it too far back, so at the moment, his issue is that he's allowing his hand to drift off the plane of entry into the anus. And that's what's causing him difficulty.
Oh, that's great, thanks.
Freeze. Look at your, what's happening is that you're pushing down with your thumb. Okay? So I know yesterday you weren't doing this. So for some reason you're suddenly thinking, don't. So the best way to get you is to hold you here. Step away from there, hold this, okay? Now there. Now that's the direction, and it's that direction you want to go. Look at your hand, it's drifting down, up and forward. Good man. Better. 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 Lovely. Don't let your hand drift off the axis. That's good. Good man. Slow it down. Good. Good. Your hand has gone forward off the axis again. Look at your hand. No, when I say look at your hand, it doesn't mean stare at the screen. Look at your hand so you can actually reference where you need it. Because if you stare at the screen, what that does, it just makes you less aware of what's going on.
Samal, you have to keep an eye on your hands as well. That's what Paul is trying to tell you. Keep an eye on the screen, but make sure that your hand's in the right position.
Good man. Nice and slow. Good man. So you can see where to go?
Yeah.
So what's stopping you going? You can see where to go?
Yeah.
So why aren't you advancing?
11 o'clock. Need to apply anti-clockwise.
No. We've been here now for 2-3 minutes. You keep looking at the same area. That's better. So you do have to advance the scope. Just keep looking at it. It isn't going to magically advance. Okay, brilliant. Well done. Good man. Thank you. No, don't overdo it. Being overzealous. Okay, let's pop that there. That's good. Good. Slow it down. You'll pick your way around if you slow it down. Lovely. Better. Hand position's better. Good. Slow down. Good. Slow down. Okay. Advance over that fold. Right, pause. Okay, just pause. Let's just get you right. Are you comfortable? Are you
No,
comfortable?
a little one.
A little no. Why?
Maybe because I'm not moving.
Well, move. Is he comfortable?
I guess he is because he hasn't. Isn't showing me response. बाबा तकलीफ तो नहीं हो रही बहुत ज़्यादा ठीक है थोड़ी सी हवा भरते हैं तो इसमें दर्द होता है आप वो तो बता दीजिएगा ठीक है
What it is that he doesn't communicate well with the patient, and I asked him yesterday to stop, and there's 3 points where I want to see you talk to the telephone, and that's what that's about. Slow down, good man. Little bit of air. Excellent. Good. Nice and slow. Now you can bring the scope across your shoulder slowly. Slowly, too much. Now blow. Don't be frightened of the air. Without it, you won't make any advance. If you've lost your view, go back to where you were. Neutralize everything. Reverse everything. Good. Now do it again. There. Excellent. Don't let your hand drift forward. Good. Keep that torque going. Keep the torque on. More. Increase. No. That's it. Just chill yourself. Bring this hand back and increase the torque. Okay.
Okay.
Yeah. Now slowly draw the big wheel back. 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 That's forward. Back. Good. Now, anti-clock, there you go. Shows you where to go. See the folds? Come back and let it dip. And go again. Good man. Good. So tip up. So how are you going to make the tip go up? Good. Now increase your torque and put a little bit of air in. Draw the scope back a centimetre. Right, pause. Okay, you've tried to get round this bend. It's been unsuccessful. You've tried twice.
Change position.
Change position. Why do we put him on his back?
This will cause this turn to come a little forward for us. Actually,
But why?
when we are at the ischemic fracture problem, it will cause the colon to.
If anything, we're at the distal descending and in the sigmoid. Okay? But what it is that you want to put a clockwise torque on the scope. You've been unsuccessful at putting the clockwise torque. Putting him onto his back will give you 90 degrees of clockwise torque naturally. Okay? Advance nice and slow. Good. Keep going. Keep going. Good. These ballsy traps today. Anti-clockwise slowly. Stop. Advance. Tip up. So big wheel back. Big wheel further back. Further back. Further back. Advance the scope. Good man. Keep going. Keep going. Anti-clockwise. Good man. Good. How was that? Okay. How's the scope feeling? Does it need gel?
I think it
Yeah. Sorry. Wait. Wait for the gel. Good man. So we've got here, you've got going round, I think, into the distal descending, just looking at what I can see over there. Okay. More than likely, if we actually look at the scope guide would suggest that we have developed a small end loop. Do not even think about removing it at this moment in time because the tip of the scope is below the apex of the loop. Okay. So what we need to do is tolerating it okay. We've had more gel on the scope which is causing you some resistance which should be relieved now. So if you continue to advance slowly, we should be able to make progress. Okay, so advance slowly. And just to let you know, my friend, we're keeping a closer eye on the time today just because of what's happening outside. And so what I'll be doing is making sure that we have an idea of how long the procedure lasts. Is that okay? So if it goes on from, we'll be stopping at 30 minutes. All right. That doesn't mean rush. Good. See where the fold is going to the right. See it? Good. Nicely done. Slowly does it. So big wheel forward, just a little bit. And allow that to, there, now go forward. Excellent, now tip up. Excellent. See how that was relatively straightforward, just by manipulating the tip ever so slow. Good.
Personally,
Good. 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 Slow. Stand up straight. It's a bit like you're cuddling up to a teddy bear in bed. Slow down. Go on. Anti-clockwise. Anti-clockwise. Ducking. Doing this does not get you anything. Right. Now draw back the scope 2 centimetres. Now I'd clean your lens. Good. Listen to what Eric's telling you. Good man. Apply the torque and draw back the scope. Draw back the scope. Draw back the scope. Tip up, so big wheel back. Stop. Draw clockwise torque and re-advance. Right. Your resistance is probably down to lack of gel. So put some gel on it now. Good man. Anti-clockwise. And okay. Stop.
Yeah.
Just stand there for a second. Let go. You can let go. That scope's going nowhere. Okay. Scope is here on the loose. Okay. Tip up. That's where you are. The reason why your anti-clockwise is not working is because the scope here is you're pushing that way. The actual scope, you're pushing this way.
Okay.
You're not advancing the scope in this line. The reason why I get you to stand here like this is that you're pushing the scope in this line, okay? So you're pushing it, you're not advancing it. And so as a result, you're pushing the scope this way. You need to advance the scope, not that direction because it's going nowhere, it's that direction. So advancing the scope is this direction. You're pushing it that direction. Advance up towards his chin, not towards his left buttock. Big wheel forward. Good. Gets you round. So then you're doing this because you're still wanting to push that direction. See how it's different now? Yeah? Good. That's better. Go on. Big wheel forward. No. Why are you pushing it forward to pull it back? That's big wheel forward, okay? There, now it's round. So you're not, you're very, very, right, let's push it forward, let's pull it back. Let's push it forward. It's not going to stay. Unless you scope with the wheels locked, it's not going to stay where you put it. And if you scope with the wheels locked, it's a very bad practice. Good man. See how you got your hand? Now for you, what I would suggest is this. Only on chaps, now advance your scope. Ask him to put this leg down.
ये वाला पैर नीचे कर लो.
Just that one. Now advance the scope. You'll feel the direction will actually be easier for you now. How does that feel now? And you've closed your stance again. So turn round. That's good.
I have to go further. I have to do this big wheel further up now, so that go down in this hole.
What you need to do is open your stance anti-clockwise. More anti-clockwise. More. Good man. More. More. Now, slowly draw the big wheel back. And now push it forward again. The big wheel. Forward again. Now. So just stand there for a second. Let me show you what's happening. Right, you're doing this. I'm exaggerating what you're doing, but that's what you're doing. And therefore, it's not going to go. Right. Anti-clockwise, left hand. What's hard? Okay? I did not let go of the scope once. Okay? I did not let go of the scope once with the left hand, with the right hand. Now advance the scope. Excellent. Go on. Increase it. Big wheel forward. Advance. Advance slowly. No, you did it again.
Yeah.
Why?
I'm
Why?
losing control over. I don't know.
But you deliberately take your thumb off it to do something. So don't take your thumb off it. Okay? You've got it going round, and then you take your thumb off it. Good. Right, clean your lens. Advance. Advance. Slowly. Slowly bring the clockwise torque up. Big wheel forward. Big wheel forward. Let me just get you past this bit, my friend, because it's confusing you a little bit. Okay, so we've got the scope. You've got to keep your lens cleaner than what you are doing, okay? Let's draw that back to there. Now, you've got to keep your lens cleaner than what you are doing. You're not keeping your lens clean enough. If you don't clean your lens, you won't be able to see where you're going. See where that's going? Now, it's all right for me to say what's hard about that, but what you were doing was you were putting your foot in, you were taking your foot out. You were putting your foot in, you were taking your foot out. In, out. It's not a, you've got to commit, but you've got to actually maintain. This scope will not remember where it was. Will not. You have to make it remember. It's clockwise torque now, my friend. Big wheel forward, clockwise torque. Good. Big wheel forward, clockwise torque. Are you cleaning your lens or are you blowing? Good. Good. Draw back the scope slowly. Keep the torque on. Increase the torque. Increase. Big wheel forward. Now back. Back. Clockwise torque. Draw the scope back. Go on. Draw it back. And suck. Stop. Advance. No. Advance. Go. Advance. Can you see how it's going forward, coming back? So for some reason, you're putting it in and hoping it'll stay. It won't. You need to commit, my friend. Right. Let me just put this scope in an easier position for you. Let go. Okay. There. Suck. Up higher. Up higher. Suck. More. Stop. When I say up higher, that's up higher. Okay, suck. More. More. That's enough. Draw back the scope 2 centimetres. Keep your tip up. Draw back the scope another 2 centimetres. Keep the tip up. Draw back the scope another 2. Another 2. Don't let go of the scope with the right hand. I seen you doing it. Okay, keep your right hand on the scope. If the grip gets taken off it, I'll do that to you. Okay, so just keep. So that's when I've just seen you doing it. So tip up. Good. Draw back the scope with the right hand. Draw back the scope. Draw back the scope. Draw back the scope. Draw back the scope. Big wheel back. Anti-clockwise. 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 Good. Big wheel forward. Draw back the scope. Ah. Draw back the scope. Clockwise torque. Clockwise torque. Draw back the scope. Tip up. Big wheel back. That's it. Draw back the scope. Draw back the scope. Draw back the scope. Draw back the scope. Anti-clockwise torque. Draw back the scope. Draw back the scope. Anti-clockwise. Draw back the scope. Draw back the scope. Draw back the scope. Clockwise. 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 Draw back the scope. Draw back the scope. Clockwise. Increase to clockwise. Big wheel forward. You need to not mess about now. Because what happens is if you mess about, you'll drop back, okay? No, 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 you're going to lose it. Okay. You nearly resolved the loop, okay? Nearly. What happened then is that you suddenly just let go of everything. Remember when I tapped you on the foot the second time? That's when you actually let go of everything. So you nearly resolved it all. Let's just get it round for you. So here we are. Right, within the same shape as what you had. Draw back, on, off, on, off, on, off. Okay, so it's clockwise to anti-clockwise, clockwise, anti-clockwise. So, clockwise. Remember when I said clockwise? Draw back, and then that's what I wanted you to do, which was go forward again. But what you did is that you let everything go. And so, if you remember from day one when I said to you about letting go of the torque, the scope then will just re-loop and drop back. Okay? So you've got to maintain where the scope is going. Right? So if you look again, clockwise torque, maintain it, then go forward. Yeah? Got to maintain the torque. This right hand, you cannot let go of the scope with. The purpose of the right hand is to actually maintain the linear tension. Okay? It puts it on, it takes it off. Good. Good man. Good man. How does that feel now?
Easy.
Sorry?
Comfortable.
Good. How's it feeling now for everybody?
For everybody, including the patient, it's really comfortable.
How do you know?
He hasn't made any. Baba?
ठीक है बाबा दर्द तो नहीं हो रहा इधर दर्द हो रहा है बहुत ज़्यादा है सामने अच्छा बस अभी हवा निकाल देंगे फिर बेहतर हुआ ठीक है
She's nice. Good woman. Good man. Now where's the lumen?
That is, I was identified.
Where? Speak.
I was thinking that it is on the.
You're fishing. Tell me, 12 o'clock, 3 o'clock, 6, 9.
It's 3 o'clock.
It's 5 o'clock. How come the preps today aren't as good as before?
not good
Not as good as yesterday. So.
Or now should I move a little forward, keeping the forward?
Yeah. If he's comfortable, which is what I asked you to ask him, and he says he is, you know that you can go forward. Now, you've only got 5 minutes left, my friend, because of looking at the time schedules. So, that's good. Now, clockwise torque slowly. Big wheel forward. Keep going forward. Good. Keep going forward. Advance. Good. That's better. Go on. Go on. Why are you leaning in? You turn your shoulder. Okay?
It's very sharp, but I guess.
Okay. Let me have a look for you. So you've got the scope in what I think is a brilliant position, okay? So you've got that there, really good. So if you want to actually increase it, see it? You can actually increase, pull back, see now, and draw the scope back. Then advance. These traps are awful. So all I'm done now is just put that into the scope to maintain it. Don't be worried about putting a loop in the umbilical if it maintains the actual direction that it's going. Okay?
Paul,
Yes, sir.
I think they have this difficulty in passing the loop to the umbilical cord. I think that's probably something that that I've noticed is there's uncertainty about that in most people, especially at this stage. I think with time they will.
I'd agree with you there, my friend. Because a lot of people are saying, you mustn't do this, you mustn't do that. I'm just looking at the chap out of my left eye. I can see that he's just moved his hand. I'm just putting a little bit of anti-clockwise torque on. If you look at the scope guide, you'll see that the scope guide...
We don't have scope guide.
Okay. So I'm going to take that first loop out.
Scope guide le aao yaar.
I'll wait. All I'm doing is taking some air down.
That looks like an apple.
Can you see how we've got the scope, my friend? In a straight line. This axis. Have you got the scope guide yet, Saad?
Yes, we have.
Right. So as I draw back another centimetre, I let the scope relax, and now I draw back another centimetre, let the scope relax, and now you can see that it actually opens up in front of us. So he had a reverse splenic Fletcher loop. Patient was tolerating it really well. He had a little bit of an end loop in the sigmoid, and the patient again was tolerating it. And what we did then was just make sure that we got everywhere that we needed to be. So we're all the way around. He actually got to the hepatic Fletcher very well. The issues that he's got is that he's trying to put torque on, and this is just to demonstrate. If you were watching his right hand, he was doing this and then letting go, doing this and then letting go. The scope will not remember that. It will not remember to stay there. If I'm here, it won't remember to stay there.
So once you've applied torque, you maintain that torque and move until you need to change the torque direction depending on what you're seeing. But once you've put torque, you should try and maintain it once you've achieved your objective of passing a certain loop or reaching a certain point, then you can reevaluate and change your loop, change your torque if you want to go clockwise from anti-clock, but you can't leave the torque.
Absolutely.
It's very well demonstrated, Paul. Thank you.
So, yeah, happy? So you need to maintain the torque, my friend. The hand needs to stay in contact all the time. Okay? So PR bleeding. So we can start slowly taking the tube out? Yeah. Yep, great.
Just come out.
Yeah, slowly come out. Why? PR bleeding. Get the view, centralise your view. Optimise your view. Optimise your view. There's no point in getting there and just yanking the thing out. Optimise your view. Optimise your view. I'm going to America.
Sorry to disturb you guys. Is Dr. Arsalan there, please?
I'm getting it in America. Black Friday. Good. Big wheel forward, clockwise torque. Clockwise and tip up. And re-advance over that bit that you just dropped back from. Good man, that's excellent. Well done. And pause and come back. Good. Are you there, Saad?
Very much.
Right. Just a question to you, if there's people in there. How do they feel about... I love scoping with the lights on. A lot of people don't because they feel that there's a glare back from some of the screens. But I've not got an issue about the lights on. My preference is to keep the lights on, except if I'm dealing with a GI bleed and then I just have them slightly dimmed because of how the image comes on the screen. And the reason for that also, I like to keep an eye on the patient. But there's a lot of people who have the lights off completely and just have a very small light in the background. What do you think? Nice tip control, my friend. Very good. Very good tip control. Very good. Now, we're in the left colon. The best position to examine the left colon is what?
Keeping the patient in the left rectal position.
Okay.
Paul, got your question. Sorry, I was talking to Arsalan.
Yeah,
The lights. I don't like endoscoping without lights.
Well, that's me.
Personally, I agree with you. A lot of, even when I'm doing EUS, I only make it dark when I'm actually looking at something that I'm not too sure of, or when but if I can see very things clearly, I don't know, somehow or the other, I don't like, I feel much more comfortable when there is light in the room, but I think it's personal preferences. It doesn't affect my, the glaze and all, to be honest, don't affect me, so I'm okay.
I agree. I do have a silly reason for it, is that there is a known side effect of midazolam and its equivalents. 60% of patients can have some strange hallucinations, and so if the lights are down on and shady, you reduce the amount of shadows, so you reduce the amount of misinterpretation, but also everything is in direct view, so of all the staff, so you can actually make sure that you are protected even more so. And that's
one more thing, I don't know if it's relevant or not personally, especially if they're ladies that I'm doing colonoscopy on, I hate to have the lights off.
I agree. Absolutely
I don't
agree.
like it.
Yep,
I mean, that's my personal view.
Yes, I agree. I think people forget how invasive this procedure can be. Stop. A little bit of air. Good man. Tip up. Good. And come back. Very good.
Yes, sir.
Happy?
Finish.
Nearly. Clean your lens. Good. Good. Now, you're very close to nearly out. Before you even attempt to do retroversion, what must you do?
To inform the patient that
Absolutely brilliant. Well done.
no surprise attacks.
No surprise attack. Good. Just letting your hand drift forward a little bit. So let your hand come close. This hand here. Here. There you go. Good man. It's an interesting effect, sir. The bowel prep looked reasonably well on the computer screen where the video recording, and then on the screen to the right doesn't look as good, which is an interesting anomaly, really.
Why, that might be because of what is in front of you. Is that an LED or the regular endoscopic? Because the LED thing actually makes it look makes it look worse.
Yeah.
So maybe that is the reason. Otherwise, I don't know.
Right, my friends.
But I mean, what would you say if you were to write about bowel prep in this patient? Would you say it was fair?
Fair, adequate.
Yeah.
I mean, the idea on this one is that fresh rectal bleeding was to exclude any significant pathology.
Yeah.
And I would.
And we have confidently done that.
Yes.
I think we'll touch that on reporting when we discuss reporting.
The main lumen is where you want the scope, okay? Now you can start to retrovert. Retrovert, good?
बाबा आपको बस थोड़ा सा तकलीफ होगी, आखिरी हिस्सा है मुआयने का, ठीक है?
And clockwise. No, not so quick. That's good. Advance again. And clockwise. More clockwise. There you go. Take off the big wheel just a little bit. And now increase it again. The big wheel. Increase. That's it. And the little wheel. Because both of them need to be right back. There you go. Done. Well done. So we've got hemorrhoids. Yeah. Good. Brilliant. Yeah. And slowly take the tube out because you want to have a look at these again as you pass through.
Paul,
Yes, sir.
would you agree with my statement we're just discussing here? Perforation in a diagnostic colonoscopy with no diverticular disease would almost always occur because of looping.
It would almost always occur of looping and stupidity.
Okay. Well, they go hand in hand. Diverticular disease would be an exception because you might go through the diverticulum, and that's obviously.
Yeah, absolutely. Loopy loopies.
In the right-left wheel becomes very useful when you're doing a difficult
Oh
diverticular.
man, yeah. You shouldn't talk steer with diverticular disease.
Okay. With diverticular disease,
Yeah.
you don't want to do talk steering.
No, I never do. Hemorrhoids.
Okay.
Never do. Because you'll cause more pain.
Paul,
Yes, sir.
I just added a line to your statement, and that is when you have, reasonably advanced diverticular disease where you are confused about the lumens. Mild diverticular disease makes, that's not an issue so much.
Yeah. With
It's when you start looking at 3 lumens.
Absolutely. And then the thing is even when it becomes strictured and narrowed, I often will revert to a gastroscope. Now, using a gastroscope, that requires a different level of expertise, and it's not something really that I would like somebody who's not well experienced to do, because that then you will perforate.
Okay.
That's very
So-
easy.
So let me elaborate on that. What Paul is saying is that if you have a stricture, or if you find it difficult to go through just because of the size of the scope, supposing you have a diverticular stricture or another stricture, then using a gastroscope for colonoscopy is possible. And obviously it's much thinner, so it will go through that area. But he's also adding that, it also, you have to be very careful and experienced, because with that little scope, you still can perforate if you're not careful.
Thank you very much.
Dressing